This is Stephanie Huff, and I'm recording a concept on thermoregulation. So looking at normal thermoregulation, thermoregulation is the process that balances heat production and heat loss to help maintain a relatively constant core temperature in the body. There are two types of temperature, one being core temperature and the other being surface temperature. Your core temperature does remain relatively constant, but your surface temperature will fluctuate and basically rises and falls in response to the environment. If heat produced is equal to heat lost, then the individual is said to be in heat balance. Two things can happen though when heat production and heat loss is not equal. If you have too much heat being produced, then you develop hyperthermia. If there is too much heat lost, then you develop hypothermia. Factors that can affect heat production. The first is your basal metabolic rate, or your BMR. And that is the rate of energy utilization the body requires to maintain essential activities such as breathing. Metabolic rates decrease with age. In general, the younger the individual is, then the higher their BMR. Muscle activity, including shivering, increases the metabolic rate, and all muscle activity does produce heat. Thyroxine output. Increased thyroxine output increases the rate of cellular metabolism throughout the body. This effect is called chemical thermogenesis, and that is the stimulation of heat production in the body through increased cellular metabolism. Your epinephrine, norepinephrine, and sympathetic stimulation and stress response. These are hormones that are neurotransmitters, and they mount a sympathetic nervous system response that can immediately increase the rate of cellular metabolism in many of the body tissues. Epinephrine or norepinephrine directly affects liver and muscle cells, thereby increasing cellular metabolism. Fever is a protective immune response to foreign antigens within the body that increases the cellular metabolic rate, thus increasing the body's temperature. Heat transfer is heat moves from one place or object to another. There are several ways that heat can transfer. The first is radiation, and that is the process of heat transfer with no physical contact. The sunshine can transfer heat to an individual that is just enjoying the warm outdoors. Conduction is the process of heat transfer through physical contact of one surface with another surface. So if, like, a newborn was placed on a metal changing table, then the heat from the baby would transfer to that surface, making the baby's skin colder. Convection is the process of heat transfer through the fluid motion of air or water across the skin. So in aquatic exercise, water flows against the moving body, and because the water is colder than the body, then heat from the body is transferred to the water, and the exerciser has to keep moving to avoid becoming chilled because the water is colder than they are. Evaporation is the process of converting water to vapor. The evaporation of sweat, in which the heat in the sweat is transferred to the air, is a natural process that to cool the body when it gets heated. All right, and so this is just a picture looking at the balance and the homeostasis of the heat in the body and trying to keep everything regulated. And this just kind of shows you how the body tries to compensate by either producing more heat or causing more heat to be lost. Physiologic review. The body regulates temperature in 3 ways. The first way is sensors in the shell and core. Most of your sensors are found in the skin. The skin has more receptors for cold temperatures than they do for warm. So the skin sensors detect colds more effectively. When the skin becomes chilled, the body tries to regulate its temperature by shivering, which increases heat production, sweating to inhibit heat loss and reduce that heat loss. And so they turn the sweating mechanisms off. Vasoconstriction reduces heat loss because basically they're trying to shunt the blood to the core where the vital organs are and away from the periphery. The second way the body regulates temperature is through the hypothalamus, and it controls core temperature. And this is a center in the body, and when the sensors in the hypothalamus detect heat, then they send out signals to reduce body temperature by decreasing heat production and increasing heat loss. Same thing when cold sensors are stimulated. It signals to increase heat production and decrease heat loss. The third thing in the body that the body tries to use to regulate temperature is the effector system, which is adjust the production and loss of heat. Alright, so this is looking at your metabolic rate and thermoregulation, and so it just kind of shows you kind of how things are going when things are temperature is hot as well as when it gets cold. Alright, so these are some of the things that happen in the body when you get hot. Causes some vasodilation. You'll start to sweat. You'll have relaxation, which just means the hairs on the body flatten, usually stretch out, try to open up, and that's just a natural thing that you do, trying to cool yourself off. When you're cold, the body affects by vasoconstriction. You start to shiver, you have piloerection, and that's where your hairs on your body will stand up, and that's a mechanism to try to get you warmer. You also tend to curl up and make yourself smaller. Alright, so some genetic and lifespan considerations. Your infants, they are what they call homeothermic, and that is an attempt to stabilize their core temperature within a very narrow range in spite of having significant temperature variations in the environment. Infants also have thin epidermis with less subcutaneous fat than adults, which makes it difficult for them to help regulate their body temperature. Their blood vessels are also closer to the skin, so newborn circulating blood is more influenced by changes in the environmental temperature. And then there's a neutral thermal environment. So basically, if you have a flexed posture of a full-term baby, they have a reduced surface area exposed to the environment because they're all curling up, and so that decreases the heat that is lost from their body. The size and age can also affect the establishment of a neutral thermal environment. And this neutral thermal environment is produced by any method or apparatus to maintain the normal body temperature, to minimize oxygen consumption and caloric expenditure. And so like that would be with the use of an incubator to keep the baby warm. Another example is if you have a small for gestational age newborn, they have with less adipose tissue and they're more hypoflex, so they're not curled up in a ball, they are going to require a higher environmental temperature to achieve that neutral thermal environment. Children's temperatures are more variable than adults, and that is until they reach puberty, and then they're more consistent like an adult. They also usually handle high temperatures well. Theirs can be up to 104 and 106, and it's not as a big a deal for them as it would be for an adult. Your older adults, they are at risk for hypothermia due to inadequate diet, loss of subcutaneous fat, lack of activity, and reduced thermoregulatory efficiency. They are very sensitive to extremes in the environmental temperature, and that's due to that decreased thermoregulatory controls. So alterations to thermoregulation. You've got normothermia, which is a normal body temperature range, and that's 36 to 37.5 degrees Celsius, which is 96.8 to 99.5 degrees Fahrenheit. You have hyperthermia. It's also known to lay people as a fever. So if they are febrile, they have a fever. If they are afebrile, they do not have a fever. Hyperthermia is classified as 38 to 41 degrees Celsius or 100.4 to 106 degrees Fahrenheit. All right, hypothermia, these are temperatures below 36 degrees Celsius or 96.8 degrees Fahrenheit. At 34 degrees Celsius or 93.2 degrees Fahrenheit, the body can no longer function and death will occur. There are three physiologic mechanisms that occur for hypothermia. One is excessive heat loss. Two could be an inadequate heat production to counteract this loss. And three is an impaired hypothalamic thermoregulation. Prevalence. These are just some statistics. 658 deaths occur each year in the United States from exposure to excessive natural heat. You're very young and you're very old are most susceptible. There's 37 children die from heat strokes after being left in a closed vehicle. Even if the temperature outside is not that hot, and it may be like in the 70s, the internal temperature of the car can heat up dramatically and very quickly. 1,300 deaths occur each year in the United States from exposure to excessive natural cold. These are more likely to be your older adults. Fever tends to be the most common complaint in children in the emergency department setting. Infection is the most common cause. Types of infections could be colds, gastroenteritis, ear infections, croup, bronchiolitis, which is RSV, and UTIs, or urinary tract infections. Concepts that are related to thermoregulation. The first is fluid and electrolyte imbalance. Increased temperature leads to increased sweating, which leads to fluid and electrolyte loss. Comfort, that's looking at acute and chronic pain. As temperature increases or decreases significantly, comfort level and tolerance of pain will decrease. Infection, looking at the prevalence of infection. Most bacteria and viruses that produce infections thrive at normal temperatures. An increase in body temperature helps the body to fight off these infections. And also, a fever alerts the immune system to increase the production of their white blood cells and antibodies that also help fight this infection. Looking at inflammation, that is the stages of inflammation. In the first stage of inflammation, the blood vessels constrict, then they dilate. The increased blood flow, which is hyperemia, causes redness and heat at the injury site, and so you have this localized thermic response. Growth and development through the lifespan. As we were talking about, infants are more susceptible to problems caused by temperature changes, both within their bodies from infections and with other environmental issues like a car with the windows closed. Children can tolerate a wide range of temperature more so than infants. And then from puberty until old age, clients have fewer problems with temperature changes. After 75, clients have an increased risk for hypothermia. And you'll see that often with your elderly clients that have infections. They will not have a fever, but they will have a low, their temperature will be subnormal and they have an infection. So that's always something important to watch out for. Genetic considerations. Hereditary periodic fever syndrome. It is a rare condition that's characterized by short but repeated fevers and severe localized inflammation. Diagnosis is made by ruling out basically all other usual childhood infections. They do have periods when they don't have fevers and they have a normal activity. Malignant hypothermia is another one. And it is a potentially fatal inherited disorder. You will see this in the OR setting because it is a serious reaction to volatile inhalational anesthetic gases and succinylcholine, which is a neuromuscular blocking agent that is commonly used in the OR setting. With malignant hypothermia, the temperature will rise very rapidly, as high as 45 degrees Celsius, which is 190.4 degrees Fahrenheit, as a result of sustained hypermetabolic as a result of hypermetabolism. They will have cardiac dysrhythmias develop, oxygen and ATP, which is where your energy comes from in your cells, is rapidly consumed. Lactate and carbon dioxide production is in excess, so those levels are going to be high. All right, prevention. Some of your modifiable risk factors. You've got hyperthermia, and with hyperthermia, interventions is recommended by the CDC that interventions begin when the outside temperature is 33 degrees Celsius or 91 degrees Fahrenheit. They do recommend in preventing to wear loose fitting, lightweight clothing, also clothing that is light colored. Wear sunscreen. Make sure that you have sufficient fluid intake. Give your body time to acclimate to the heat. Know if your medications make you more sensitive to the heat is another issue. Some other things that can increase the risk of developing hyperthermia are age, obesity, being unfamiliar with the climate, and then again those medications that predispose them for heat sensitivity. Your hypothermia prevention, reduction of the ingestion of alcohol and other drugs is important because they will decrease alertness to the outside weather changes, and they can actually get really cold really fast without even realizing it. Hypoglycemia in people with diabetes makes them less aware of their surroundings. Also, medications that cause sedation kind of have that same effect. Screenings for hyperthermia, that is with malignant hyperthermia. They can do some genetic testing or muscle biopsies to diagnose that, and usually that is only done if they have a known family member that has the disorder, or if they suspect that that individual is actually going through it. But genetic testing, there are 2 companies in the United States that have been approved to do the genetic testing for malignant hyperthermia, and you can actually send a sample in the mail. The muscle biopsies, there are 5 facilities in the United States and Canada that have been approved to test those muscle biopsies for malignant hyperthermia. Hypothermia. Your neonates and older adults are more susceptible. Some of the things that increase risk of hypothermia are going to be outdoor exposure, drugs, trauma, alcohol and drug abuse, endocrine disorders, neurologic impairment or autonomic dysfunction, dermatologic disorders, your multi-system disorders. Those are going to include things like malnutrition, sepsis, shock, hepatic or renal failure. Looking at your assessment, thermoregulation is assessed primarily by measuring body temperature. It is measured in degrees on 2 scales, either Celsius, which is centigrade, or Fahrenheit. Nursing assessment sites for your temperature measurement can be oral, rectal, axilla, tympanic membrane, and temporal artery. There are some advantages and disadvantages for both of those. On page 1427, table 20-1, it gives an example of all of the advantages and disadvantages, and it also describes the site and how the temperature is measured at those sites. Your diagnostic test, these are done if the patient presents with a fever or if you suspect an infection. They might do a CBC with differential. You have to make sure that you order the differential along with the CBC, because if you just order a CBC, that's all you're going to get, and they will not automatically do a differential. Sometimes it's better just to go ahead and order both, because if the CBC ends up being normal and there's nothing abnormal, then a lot of times there's not going to be anything to show up on the differential, so the lab will cancel the differential. If a fever is related to head trauma, then they're going to need imaging studies to determine the degree and location of the trauma. And then looking at interventions and therapies, some independent interventions are going to be maintaining thermoregulatory mechanisms by supporting patients' environment. Your older adults and young infants are going to need a warmer environment, because remember, they're more susceptible to cold. Your infants and children should wear hats, because they can gain or lose more heat from their head than adults because of their really large head in comparison to their body. Adequate hydration is especially important when the ambient temperature is hot, because dehydration can present with low-grade fever, but this fever will go away once hydration status is restored. Collaborative. There are 5 types for collaborative care. The first is pre-hospital care. And there was a study done that found that about 11% of pediatric clients that had severe sepsis were transported to the emergency department by ambulance. And so your EMS personnel has to pay really close attention to do their ABC evaluation, evaluating the airway, breathing, and circulation. For your toxic appearing children, and these are the kids that are lethargic and irritable, they're pale or cyanotic, initiating an IV access is important. Seizure precautions should also be followed in children that have a history of febrile seizures. When you're looking at older adults, you're going to use the same kind of considerations that you did for your pediatric clients. Emergency department care. Again, the ABCs are going to be your first priority. In addition, they're going to make sure they're checking temperature, pulse, respiration, blood pressure, pulse oximetry readings, and record those. In children, getting a weight is going to be appropriate so that you can make sure that you give the correct dose of your antipyretic medications, because those are based on weight for children. Antipyretics should be given as soon as possible after they enter the emergency department setting and we realize that they have a fever, so we can bring that fever down. Even if we do get the fever down and it's with the normal limits, that still does not mean that they do not have some type of bacterial infection. All right, inpatient care to a pediatric, geriatric, or other designated care setting. Client's age does not make a significant difference if they're admitted or not. Your newborns up to 28 days old with fevers should be admitted to the hospital. And usually that is just because there's so many complications that can occur. And they're so small that things can change very rapidly, and that's usually the safest place for them to be. After they get older than 28 days, hospitalization will depend on factors in their individual assessment, but the decision is usually guided by protocols. Home care is often the treatment of choice because it avoids exposing the client to the healthcare associated infections. Sometimes you cannot establish a cause of what the fever is coming from in about 10% of your patients. Usually the rest of them, about 80%, have some type of infectious disease going on. Most of the time it may be a respiratory illness. Sometimes you can have fevers from non-infectious sources, from cancer, autoimmune diseases, and some of your other non-contagious diseases. Admission to the intensive care unit, there are some cases when they have to admit the patient to the ICU setting because of a fever and the severity of the infection that they have. Outpatient and follow-up care. If the client or caregiver has access to further communication with primary health care provider, continued monitoring can take place at home. And so there's always protocols in place of when they need to notify their physician for changes, or if they need to follow back up with the emergency department. They can also establish a protocol if they want to draw labs and then send the patient home, and so that they can get their lab reports to them. Your antipyretics, these are going to include like acetaminophen, which that's going to be like Tylenol, your ibuprofen, those are your NSAIDs, and so that would be like naproxen, Aleve, Midol, Motrin, Advil. Then you've also got acetylsalicylic acid, which is aspirin. And all of those can be used to help bring the temperature down. There is a chart on 1430 that has all of these, and it looks at mechanism of action, uses, safety in pregnancy, lactation, nursing implications, side effects, so you can get a lot more information from in those. So this concludes the concept of thermoregulation. And as always, if you have questions, let me know and I'll try to help clarify.